Welcome to MU Healthcare and Y107's Ask the Expert podcast. My name is Cosmo. Our expert today is MU Healthcare cardiologist Mary Beth Fisher to talk about heart disease. You know, it is the leading cause of death in Missouri, and it's called the silent killer. So, doctor, how do you know if you are at risk for a heart attack?
The most common heart disease in the U.S. is coronary heart disease or heart blockages, presenting as signs or symptoms of chest pain, shortness of breath, back pain, neck pain, nausea, fatigue when you're trying to do something. And so those are signs and symptoms that may bring your attention to this. But really, to understand your risk, you need to look at what your metabolic profile looks like. That includes your cholesterol panel, your A1C, what your blood pressure looks like. And one of the things that MU Healthcare offers is a Love Your Heart cardiac screening, which includes all of those metabolic panels that I just discussed, as well as a cardiac calcium score, which looks to see, do you have any evidence of coronary artery plaque or not? And that can really change how you approach your prevention.
What are some of the myths surrounding women and heart attacks?
Well, women don't think they're at risk, but unfortunately it is the biggest mortality risk for women. So more women die of heart attacks than all of the other cancers combined. And so 1 in 3 women will die as a result of heart disease. And a lot of times we traditionally think of heart attack symptoms as chest pain, that pressure elephant on the chest. But some women present differently. They present with more shortness of breath, back pain, neck pain. Also, women have some unique risk factors that are separate from men. Most notably is their pregnancy history. A lot of times women will have what I describe as adverse pregnancy outcomes or hypertensive disorders of pregnancy or diabetes during pregnancies. And that can be a red flag for what our future risks look like. And those are important things to discuss with your doctor to see how we can modify that risk to prevent us from becoming a statistic.
Get signed up for that MU Healthcare Love Your Heart cardiac screening. You can go to muhealth.org/loveyourheart or call 573-882-4439. We've got cardiologist Mary Beth Fisher here with some great advice. So, doctor, tell us about this Love Your Heart cardiac screening that MU Health has going on.
Yeah, so MU Healthcare has a Love Your Heart cardiac screening. It's designed to help patients catch potential cardiovascular risk issues before they become a problem. Consider a Love Your Heart cardiac screening if you answer yes to any of these questions. You have a family history of heart disease, you have type 2 diabetes, you have high blood pressure, you're a smoker or a former smoker, or have had a pregnancy history that includes gestational hypertension, preeclampsia, or gestational diabetes, and you answer yes to any of the other questions. This screening includes a full lipid panel, an A1C. This helps to evaluate if cholesterol is a problem for us or we're at risk or have developed diabetes. And then the coronary calcium score allows us to see if there's any calcium deposition in the heart arteries. This is plaque that can tell us if you have coronary artery disease or not. And this allows us to tailor our medications to further reduce your risk later on down the road.
The Love Your Heart cardiac screening that you were just talking about, it's designed for anyone with high blood pressure, a family history of heart disease, a smoker, or someone with diabetes, correct?
That's right. And the screening includes a full lipid panel, an A1C. This evaluates for cholesterol and our risk of developing diabetes or if we already have diabetes. And then it includes that cardiac calcium score, which uses a CT scan to check for calcium deposition in the wall of the heart arteries. This allows us to see, do you have development of heart disease already, and what can we do to reduce that risk of further progression? And it's really important to note that there's no need for a referral for this appointment, and the screening takes less than 1 hour. There's no need for insurance. The cost is just $120, which is collected at the beginning of your appointment and covers both the blood work as well as the CT scan. And that is obtained prior to your scan, and it is a part of the registration process.
You know, some folks don't have health insurance and feel maybe like medical tests aren't affordable or accessible. That's not the case with the Love Your Heart cardiac screening, correct?
Exactly. MU's Heart Health Love Your Heart cardiac screening. There's no need for insurance. You don't need a referral, and the cost is just $120, which includes all the lab work as well as the CT scanning. So these are great data points that can really help us reduce our risk. And it again includes a laboratory analysis looking at your cholesterol panel and your glucose measurement through an A1C. And this evaluates our risk factors as well as the cardiac calcium score, which looks for calcium deposition in the walls of the heart arteries and can help indicate early development of heart disease. You'll be notified of your results via a phone call, and the results will also be sent to your primary care provider if you have one. So really important resource and way to assess our risk for heart disease.
Yeah, schedule it right now. Go to muhealth.org/loveyourheart, or you can also call to get that MU Healthcare Love Your Heart cardiac screening. Call 573-882-4439.